Hello and welcome to your informative health program, Health Business. Our mandate on this program is to keep you informed on different health challenges, the management as well as prevention. I'm your host, Oluwatoyin Kolawole. There has been lots of controversies surrounding the National Health Insurance Scheme in Nigeria. While others accuse NHIS of corruption, some people blame the HMOs. What are the challenges facing the NHIS in Nigeria? That is the topic on Health Business this morning. Stay tuned. With me this morning to discuss the National Health Insurance Scheme, its challenges and way forward is the National Chairman of the Health and Managed Care Association of Nigeria, Dr. Babatunde Ladele. You're welcome on Health Business.
Thank you very much.
All right, let's start off this way. Some people may not know what health insurance is all about. I want to educate our viewers on the significance of the National Health Insurance Scheme in Nigeria.
Okay, to put it simply, health insurance is close to insuring any other thing, but this time you are insuring your health. You are putting some money aside that in case I'm ill, I may not have the kind of money that will be needed to take care of me. So our organizations are specialists in pulling this money together. Little from you, little from there, little from there, so that the percentage of that pool that is ill, we use that money to look after them. So what health insurance manages to do is to make sure that these out-of-pocket expenditures that can be catastrophic for individual is minimized.
All right, so what are the challenges facing health insurance scheme in Nigeria, and how can these issues be resolved?
Well, there are many. You see, let me put it this way. The world at large is now talking of universal health coverage. What actually that means is that any individual, no matter how disadvantaged that person is in terms of funds, finance, can at least have access to good health, promotive health, preventive health, curative health. That is the way the world is going. That nobody, no, not a single person, whether that person is a vulnerable group, whether that person is an old person, it has no creed of maybe religion, sex, gender. So that's what the health insurance is trying to do. The act itself didn't make it compulsory. That was the number one issue there. If it's not compulsory, in other words, if it's not mandatory, you can either say, well, and then look at the issue of health in Nigeria. One is concurrent, one, the state can do whatever thing they like. It's moral persuasion that could make them toe the path of the federal government. That is part of it again. And the other problems are man-made. You'll find out that the act itself has been subverted by nearly all the players, including HMOs, so to say, because although it will be self-suicide if I said that HMOs, yes, HMOs have some problems, but we have had known that all along that HMOs are going to have problems. And some of these things are being addressed. And then some are being addressed by ourselves. And we are trying to even make sure that we help the regulator regulate our members. Maybe we've not done enough. It's left to be judged. But again, if you look at this scenario, the paradigm shift from the left to the right in a way that is now making health business. You know, in those days, health business is people should fall ill. When people fall ill, I make money. No. But now, the less people that are ill, the more money I will make. So the doctors are not going to like me. And then the moral hazard that is inherent in Nigerian retainership system, where you go to a hospital, they give you money, you take a bill to your company and they pay. So that is now not there again. So those enrollees themselves, they're not going to like me. And then for the doctors that have been making money by being patronizing, and all of a sudden there's a scheme that's taking all those away, they're not going to like me.
Okay, you said initially when we started that the world is moving very fast in terms of health insurance.
That's right.
And that what we have in Nigeria is not really how it should be.
Yes.
Sincerely, I want to ask you,
Yes.
do you think Nigeria is ripe for health insurance?
Why not?
National health insurance?
We are. Very, very ripe. Overripe, sir. We are. Now, there are a few things that need to be put in place. If you've been following the trend lately, we had to be shouting ourselves hoarse before a council is in place. Now the council is in place, so we are sitting and watching the council perform. We are praying they succeed. This particular council, just because they are coming at the right time, that things seem to be falling apart in the NHIS scheme itself, or the schemes itself. I pray that they succeed. On our part, we'll continue to play our role. We'll continue to advise them. We'll continue to say it as it is. Because really, we have no other business than this now.
There is a question that was sent in from one of our viewers. I want you to educate us on this. Why is it that if my company enroll in with a particular HMO,
yes,
and I'm at the hospital, complain of something,
yes,
a test will not be run on me, I'll just be given a particular drug to go and use, while another person that was enrolled with another HMO will get like a comprehensive health package Can you please explain this? Because many people are still confused about this.
Okay, now again, this particular system that we are running, the enrollee is still the king. One, you have the right to choose your hospital. So if you choose a hospital and you think that hospital is not good enough, you are free
To change.
although as I said, part of the job of the regulator is not to be changing enrollees from one hospital to another, but they've usurped that. So sometimes somebody may not like one hospital, and before you send the name to Abuja, before Abuja does that, blah, blah, it may take a year or two. Whereas on our private scheme, it takes less than 2 days. So that one disenfranchises some of the enrollees. So the enrollee is king. The enrollee, again, then perception of the enrollee is to go to a hospital and say, this is what I expect. A doctor doesn't want a patient to come in and say, no, I think I have malaria. And then if you know you have malaria, go and treat yourself. So the expectation is that I want social drug. And if you remember, I told you about the paradigm shift. In those days, the more drugs you get, the happier you are. Whereas you may not need those drugs. That's what managed care tends to. They want to treat you quickly. They want you to get well quickly. They want to investigate you if it's necessary. Not frivolous. Just because you want to make money. So if you have, there are some people who are particular about themselves, who think of their health every minute. They get to hospitals, they expect this type of treatment. Mark you, majority of those who complain about one hospital will complain about other hospitals. Some say they get to one hospital, they are treated as, once they know their NHIs. But those hospitals have told us that they actually are trying to make administration easy. Okay, some come and complain to us that our folder in that hospital is pink, whereas other fee people's paying on is brown. They only give us chalk. Again, the enrollee is king in the sense that the enrollee can escalate. If you are in a hospital, you don't like the way you are sitting down, they are seeing others, you are not being seen at the time you have to be seen. Pick your phone, call your HMO. This is the experience I'm getting here. And you talk to the hospital. Well, I don't want it, but you need to tell us why you don't want a hospital. Otherwise, if we think you want to be doing mago-mago, and the hospital is not ready to do mago-mago with you, then you come and tell us you don't want, then you just say you don't want this, you don't want that, you know.
Okay, lastly now, we've identified the issues, the challenges in National Health Insurance Scheme. What do you think should be the way out, the solutions to all those challenges?
As I said, all the challenges you have, as I've enumerated them, they are man-made. I think this particular council, the board that's been in place, the board that's just been put in place, are likely going to sort out most of it if it's allowed to operate. I think the council will sort it out. They started in a very bright way, and I'm confident this particular council will be headed by a woman. So they should be able to solve the problem. The problems are not, there are personality problems. I don't like you. I don't like your face. You cannot do this business. This is my father's house, or this is my own property. All those bickerings, they are not necessary in the first instance. If the enrollees is key, if the enrollee is what everybody is fighting for, they say when elephants fight, it's the grass that suffer. We don't need to do any of those things. We need to just be thinking of creative way to let the health insurance continue to expand. And the ways to do that is so straightforward. We are available, we are ready. Also call us, 1, 2, 3, let's do this, let's do this, let's do this. We don't have the monopoly of knowledge, but we know what to do.
All right, Dr. Ladele, to my last question now. Where do you see the health insurance business in the next 5 years?
They are now sounding like the executive secretary. When he came in fact, he gave us a paper on that. Now, can you please tell me where you expect the NHIS to be in 5 years? I was one of those who midwise the papers. Well, I'm sure he's thrown it into the trash. We expect universal health coverage. At least we expect at least about 30% of Nigeria to be covered in the next 5 years. Although 30%, because when I was defining universal health coverage, I was talking of 100%.
Yeah.
But 30% will have been so meaningful.
Okay, 30% of national health income.
I mean, if we look, I'm expecting, let's say we are now about 200 million, I'm expecting at least about 60 million to have been covered. That's what I'm just trying to say.
It's okay.
In another 5 years. And that would be significant. That would be significant.
Well, it has been so nice having you on Health Business this
Thank
morning.
you.
So very nice. And I'm sure our viewers must have picked one or two information concerning the HMOs, because this particular topic was one of our viewers said she wants to know about the health insurance scheme in Nigeria and about the HMOs. So, Funke, if you are watching, this is your topic, and I know you've learned a lot concerning HMOs and NHIS. Thank you so much for being part of the program.
Thank you.
Dr. David Ikuda is ready to take us through the world of regenerative medicine. Stay tuned.
Hello, viewers. Welcome to today's episode on regenerative medicine. I'm Dr. David Ikuda, regenerative medicine specialist. We'll be talking about how regenerative medicine can be applied in sport medicine, or maybe to treat sport injuries. Regenerative medicine has been shown to have benefits for treating athletes. A good example is using platelet-rich plasma therapy to address injuries in sport. Platelet-rich plasma therapy is when you take a patient's blood, process it, and take the part of that blood that is very rich in platelets. That's where the name platelet-rich plasma comes from. And you inject that into the injured or damaged part of the body. And that helps to accelerate the healing process. As some of you may be aware already, stars like Kobe Bryant or maybe Tiger Woods, they've had platelet-rich plasma therapy, and that has helped them to recover quickly from the injury sustained during their games. Talking about, let's say, golf. Tiger Woods in December 2009 had golf elbow injury, that is injury into the inner part of the elbow. He had platelet-rich plasma therapy in December 2009, and if you have been following the US tournament, you will find out that the following year, 2010, was the best PGA Tour for Tiger Woods. People that love basketballs, we find out that sometimes Kobe Bryant was injured, and within a short period of time, he was back on the court playing basketball, all thanks to platelet-rich plasma therapy. Another area that platelet-rich plasma can be beneficial is for people that have maybe joint pain, like it could have been due to damage to the ligaments or the meniscus in their knee. or maybe they might have had a surgery, let's say total hip replacement surgery, and they're having pain after the surgery. Platelet-rich plasma can help to alleviate or get rid of these pains post-surgical, in the post-surgical areas. Or if somebody does not want surgery and they have a partial tear in their ACL, which is the anterior cruciate ligament, or the posterior cruciate ligament, PCL, they can get platelet-rich plasma. As long as there's still some, attachment among the ligaments, regenerative medicine will help to accelerate the healing and then complete the repair without any surgery. So regenerative medicine is becoming more popular as an alternative to surgery in certain areas. Other things that people benefit from regenerative medicine is like using adult stem cell therapy. That is when you take the stem cell from the bone marrow or the fat from the patient, and maybe even umbilical cord blood in certain cases. And you take the stem cells and use them to accelerate healing in the area of the body that you need it. So the type of conditions that can be treated under orthopedics or sport injury is kind of very broad. So if you're thinking of avoiding surgery, you may want to consider regenerative medicine. Ask your local doctors to see if they can be of help to you and where you can get it done. So medicines are advancing every day, and we're trying to make it more easy for patients to have the treatment they desire without always having to go through surgery. I believe I've been able to educate you, with the basis of regenerative medicine, and now it can be used for either sport injury or joint pains. And I'm looking forward to see you next week when we're going to be talking about another topic on how regenerative medicine can be of help to you. Till then, have a nice weekend.
Up next is Mother and Child. Today we'll be educating pregnant women on how to stay healthy.
The process of pregnancy causes many hormonal and physical changes for women. For that reason, it's important to maintain a healthy lifestyle when pregnant for the well-being of you and your unborn baby. Here are some guidelines to achieve that. Pregnancy do's. Maintain balanced nutrition by eating a variety of healthy foods. Cook all meat and poultry products thoroughly before eating. Drink extra fluids, especially water, regularly. Physical activity is good for you and your baby, unless your doctor tells you otherwise. Pregnancy don'ts. Avoid smoking or staying in smoke-filled areas. Limit your caffeine intake to less than 200 mg a day. Don't eat too much liver or liver products, as they may contain large amounts of vitamin A, which may harm the baby. Reduce instant foods, preservatives, flavorings, and colorings. Avoid flights before 14 weeks or after 30 weeks of pregnancy. Remember, always seek medical advice if you have any concerns. Till next week, when we'll bring you another topic on mother and child, stay healthy.
This is where we draw the curtains on health business this morning. For sponsorship and advert placement, please call the number showing on your screen. And sincerely, we really need sponsorship at this time to keep the program on air. My name is Oluwatoyin Kolawole, and the program is Health Business. Remember, living healthy is a serious business. Bye for now. Thank you.